Okay, this is your letter. I hope you can see the screen as well.
No, I cannot see anything on the screen at the moment.
Okay. Can you see now?
Not yet. Yes, yes, now I can see.
Okay.
Yes, I can see the screen.
Okay, let's talk about your letter. So this is fine. You can mention things this way, no problem. Date is also okay. Dear Dr. Cross, there should be a comma over here.
Okay, all right.
And Mr. Brett Hollister, date of birth. Okay, fine. This is okay. Let's move forward. Okay, I'm writing to refer Mr. Cholester, who has signs and symptoms suggestive of diabetes mellitus. So this D and this M should be small,
Okay,
and this P as well. Okay,
okay.
for further assessment and management under your expert care. Okay, this is fine. Mr. Cholester is an overweight married man who has the BMI
Off.
of,
I
yeah,
missed
and weight of
off. Okay.
89 kilograms
Perfect.
respectively. So the thing is, whenever you're writing weight and BMI, you can write one. Okay, either
Okay.
write weight, either write BMI. You don't need to
Okay.
write both things
Okay.
because both are similar things. Both are telling you the actually either it's a body mass index. You're just trying to tell the reader that whether the patient is obese or not, right? So BMI will tell whether the patient is obese or not, and so as the weight.
Okay.
So you can write one thing. On the state, Mr. Cholester presented with complaints of tiredness and fatigue along with dizziness for last 3 to 4 weeks. Moreover, he also had discomfort in his eyes. On examination, this E should be smaller.
Yeah.
B should be smaller. Blood pressure of 108 over 61. Heart rate H should be smaller. 78, weight 94 kilogram, and BMI 30 respectively. See, respectively, it's something you can write like with two things they are fine to write respectively, or three things like, but you can't just write the whole bunch of information and just write at the end it's respectively.
Okay.
Okay, and here you don't need to write respectively actually, because you're mentioning BP is this, heart rate is this, weight is this. So there is nothing respectively. If you would have written blood pressure, heart rate, and weight, okay, and then you have written the values like 108 over 61, 78, and 94, then there was a word that could have been written the respectively, right?
Okay.
Not this way. Okay. Same goes here as well, because you are telling the weight. If you would have written this way, that BMI and weight, like who has the BMI and weight, and then of 28.4
And
and 89 kilogram
okay.
respectively. Yeah,
Okay.
but it's not the other way around.
Okay.
Okay. Snowfall page. Meanwhile, he reports no adjustments to lifestyle, exercise, and diet despite being advised to reduce weight in his previous visit. Consequently, he was ordered for relevant blood investigations. Okay, see, he can't be ordered, right? You cannot order the patient, okay, I am ordering you, go and do that.
Mm,
So, yes,
advised.
no, I mean, you can write the word order, okay, it is
Mm-hmm.
fine, but it should
Mm-hmm.
be in a passive way that should not be like you don't need to sound like rude or something, okay?
Okay.
So, consequently, some relevant investigations were ordered. Okay,
Okay.
so this is a
Okay.
passive voice. Okay.
Mm-hmm.
Today, Mr. Collister reported no any improvement in the symptoms. In addition to this, he complains of
Mm,
decreased vision. Furthermore, on examination, he had reduced 5 kilogram of weight. Meanwhile, his blood reports showed HbA1c of 8.5%, along with increased random and fasting glucose as well as elevated serum HDL and LDL levels. In view of the above, your further assessment and management is highly appreciated. In case of any queries, please do not hesitate to contact me. Yours sincerely. There
should
should
I?
also be comma over here and doctor.
S S should be capital or small? Sincere.
This should be smaller.
Okay.
Okay. Now, if you ask me about this letter, see, it's a decent letter. Okay,
Mm-hmm.
I like. I'm not saying your writing is bad or something.
Mm-hmm.
Your organization is fine. There are a few errors, but the problem is this is not an ideal letter for the OET exam.
Mm-hmm.
Okay, so
Okay.
you won't see this the smaller letter with this
Mm-hmm.
much of information, and like these days they give them the a bit of a more information in order for you to make it more concise. Okay, but
Okay.
however, you know how to arrange it. That's a good thing. You
Mm-hmm.
know the basics. That's fine. And
Mm-hmm.
but there are a few errors that as I mentioned. So what I'm gonna do, I'm gonna send you the PDF of
Mm-hmm.
letters which have high yield letters that you can write them down. And once you okay, let me just stop the recording.